also known as the Holistic Guru. Just in recently, just this week, I got back from the West Coast. The and let me do this first. For those people who are not familiar with me or my background, I started in holistic health a long time ago. My interest actually started after a couple of things happened. Um, I'll say early in my childhood, really. I had, I guess it was chronic sinus infections or something and tonsillitis. And so I got an adenoidectomy, a tonsillectomy, um, got that, those surgeries because of whatever was going on at the time. And I think it was really at the base of it. I'm pretty sure it was a dairy allergy, but the methods of the day said, "Oh, you're having a problem with your tonsils. We're going to take them out, and we'll give you ice cream, all the ice cream you want." That's how they induced kids to do that. But I was obviously having some immune system problems early on, okay, or some allergy problems early on. So at 10, lost my tonsils and adenoids. At 17, I got very sick. I was in my senior year of high school. It was in the winter, and I don't know if it was cold or flu, but it went to mononucleosis, and then it went to rubella or German measles. My immune system crashed. I was sick for about a month. I could hardly breathe through my nose or my mouth. Okay. And even today, that's like of my body systems, that's the weakest system. If I when I overwork and get overtaxed, stressed or whatever, it's my immune system that's typically what shows up. Um, I get overly tired, and then it's a cold or something. And yep, occasionally I get colds. I get or what would be considered a cold. Okay. And there are some people who kind of frown on that, and they say, "Oh, you're holistic, and you're not supposed to get sick." Well, really, there's a couple of different ways of looking at that, in saying when we get pain, when we get discomfort or inflammation, if we get a cold or flu or something, that's our body giving us feedback. Okay, so it's not necessarily a matter of never getting sick again. I'm not gonna tell you that if you do X, Y, and Z, if you do what I say, you will never be ill again in your life for what we call illness. Okay. And we have these acute illnesses like a cold or flu or something. Would be acute is something that typically comes off pretty quickly, and it's of short duration. What we really are plagued with is what we call chronic diseases, chronic ailments, things that go on for a long period of time. You got persistent high blood pressure, heart disease, cancers, and different things that will take us out. That cause for long-term um, medication or something, or those things that will kill us. Okay, no problem. So it's how we manage our health. So I'm going to assume that those of us who are on the line, those of us who are going to, or of you who are going to hear this, are going to take this and utilize it to manage your health and in the health of your family members. Okay. So, again, when I was 10 and I was 17, I was sick for a month. And, again, it almost took me out. This immune system shutdown almost took me out. And I think it was a combination of things. I think it was allergies. I think it was that whatever the cause was when I was 10 was not really addressed. They didn't, my diet wasn't changing or anything. Tonsils and adenoids ago, but what was I allergic to? What was going on that should have changed? And then senior year high school, I know I was under a great deal of stress. There was a lot of things going on. So there are a combination of factors that'll make us sick, that are mental, physical, spiritual. That's kind of the holistic paradigm. It's not just one thing. It's not just what you're eating. Oftentimes it's what's eating you. So it was around the time I was 17 and going into my 20s, just right after high school, and as I worked and then went to college, that I really discovered holistic health, and it was through Dick Gregory and other people who were out here who were talking about health and wellness and what was really important, what was possible. Dick Gregory had been a heavy drinker, and I think he drank, he smoked, he was uh, the probably most famous, definitely the most famous Black comedian, and the one who kind of broke the color barrier and got on to Jack Paar show and really was making a lot of money back at the time. Turned civil activist and turned vegetarian. He turned his life around, turned his health around, and went from just doing comedy to advocating for health and wellness and social causes. Okay, and that kind of goes together as well. It's important to note because typically when a person starts taking care of themselves, they start thinking about the welfare of other people, and oftentimes this movement, this personal endeavor, this personal work becomes something greater than ourselves. And of course, as we mature, we tend to start thinking about more than our own welfare. We think about our children, our grandchildren, and future generations. And today we're thinking about the environment. We're thinking about people in other countries. It's kind of part of the evolution of how things go over time and where we're headed. So yeah, so I started, looking at diet, nutrition. I read Dick Gregory's Diet for Folks that Eat. I distributed Dick Gregory's Bahamian Diet. That was one of the things that got me started. I started distributing that. And then I was started Detroit Holistic Center in 1987, ran that for 32 years until we closed for COVID in 2020. But that was really the impetus. But it was time for change. It was time for transition at that time. And so during the years that I ran Detroit Holistic Center, after of course, doing a great deal of studying, a great deal of research and application, and a lot of certifications leading up to my doctorate in naturopathy through what we call a naturopathic school. It was just kind of the culmination of decades of work and clinical research that I had done to get my doctorate, and of the things that I've learned over the years, working with a staff of up to 12 people. So I had anywhere from 2 people on staff to 12 people over the years. We saw over 60,000 people over those 32 years. So we impacted a lot of folks. I did a lot of consultations, a lot of one-on-one, a lot of speaking. I did radio for about 9 or more than 9 years, and just a lot within the community. So people in Detroit, as well as other parts of the country, know of my work and have known of my work. And the closure in 2020 really did 2 things. I mean, it was devastating, first of all, because because of COVID and things were shut down, and we weren't able to, I was not able to operate a bit as a business. But even more so, I was so accustomed to interacting with my staff and with people. That part was devastating. And closing a business and having to come, that's not how I envisioned it, but it was somewhat necessary in that I had to look at what I could do and not just what I couldn't do. So I got out of the house in a time. I started preparing all my meals at home. So I was doing plant-based and doing all my meals at home. I'd stopped eating meat a long time ago, but I was doing all plant-based and working with some recipes and kind of really getting in the kitchen there. And I started running. So I subsequently lost close to 40 pounds over a matter of months through primarily what I was eating and running and just having a regimen that oftentimes I would share with our customers and clients in the community. And I said, okay, well, I'm mean, do this for myself. I know what to do. Okay. My blood pressure had going up at the time. I mean, anybody. I don't know how many of you may have run a business before, but anybody's run a business, much less a service business, and where you have to work with the public, that there's a lot of stress with and managing staff and on and on. And I hadn't had a break and I realized in good 40 years, okay, since somewhere in my college years. So I had not had a break or summer off or so. So it was good for me to take that break. And in that, I did some reflection. I said, what do I do from here? And though, people still today say, when are you gonna, you're gonna open back up? What about, this? And the services were so good. I realized at this point in my age, my stage, and in my career, that the best thing for me to do was to share what I learned over the years and to leave a legacy. Most of my colleagues, most of the people I've known, Dr. Laila Africa, Dr. Sebi, and Queen Afu, and people who are past and present, and Dick Gregory and such. Many people kind of die with their boots on. They're still working, and they pass away. They don't retire from this work so much. I said, I want to retire. I want to teach what I've learned. I want this to be a generational benefit, and do it while I'm still in good health and still be able to enjoy myself and just leave a legacy, okay, for my children and grandchildren and future generations. So it's something that typically did not happen. Dick Gregory didn't have a school, and I mean, so many people do not leave that legacy of what they learned and put it in ways that people can take that and run with it. Okay. I don't want to do so much the one-on-one, because if you rely on me for your health and wellness, and you say, Dr. Brown, what about this? What about that? And people do that all the time. And they want a quick, sometimes they want a quick and easy answer, or they want a consultation. But I say, now, if I give you an answer to something, that's one level of sharing. There's some value in that. But if I teach you, when I train healers in every home, in every family, in every community, when I share with people what I've learned or methodologies or systems, then you end up doing it for yourself and you can help others. And that's what we've got to do, because our healthcare system has essentially failed us. Our healthcare system has not worked as many of us would like it to work. It's not a prevention system. It is a sick care system. And with COVID and with so many things, it's lost some credibility. It's lost effectiveness. Okay? And I'll give an example. At the time that COVID, especially, was full blown, and they're saying get vaccinations, the mistake, the missed opportunity that the medical industry did not execute, did not take advantage of, was the fact that at the same time, simultaneously to giving the vaccinations, they also could have given people some guidance that would have impacted them as well, equally so, if not more so. I give an example. So you probably have read or heard that people who had chronic ailments, people who had high blood pressure, whatever respiratory, problem, asthma, emphysema, any number of different chronic ailments already, were at higher risk for contracting COVID and dying from that. Okay, so at this time, if we were in the audience, I'd say, give me a raise of hands who's heard that and who knows that. But if you didn't hear it before, then you got it now. But if you had heard it, then my thinking said, wait, if chronic people with chronic ailments, and particularly people of color and people in what we call underserved communities, the poor, etc., if we're contracting at higher rates and we're having higher rates of these chronic ailments, and that's exacerbating the results that we get with COVID, then the sensible thing to do, the most humane thing to do would be to say, oh, by the way, if you, and I'm not going to go into a debate on whether or not to, vaccinations, yes or no, or boosters and all that. I'm not going to have that discussion, at least not today. But I will say, when they have a person in the office, wherever they are, about to get the shot, why not say, do you drink? How much are you drinking? You smoking here? How are you eating? What about your rest? Are you getting exercise? Because to combine, I believe that the medical industry would have more credibility and would get different results if they were able to do something, execute more of a protocol instead of just a jab, okay, and not just a puncture wound, right? Um, because just think about it. It's like, okay, COVID is killing, all these people, hundreds of thousands and of people who are, getting COVID and dying from COVID. Okay. Then don't you want to do everything you can do to prevent and to address the problem? So if you know the chronic ailments is an issue, address the chronic ailments along with that. And that becomes more of a holistic protocol. And that's one reason why our medical system is not working as well as it could be. And that's a reason why so many people are seeking out alternative foods. There are, again, we saw over 60,000 people. We had we were many times quite busy. There were times that not as much, but over 30 years, we just more and more people came. We were seeing people intergenerationally, and many doctors and people in the medical field say, well, you all don't accept insurance. How is it that so many people are coming to you? They're coming, we have a hard time getting them in for when they have insurance. It's being, they got healthcare coverage and they're paying out of pocket because all of our services were out, right? And it's because people were making an investment in their health and they were believing in what we do, right? They were getting results from what we do. We would get, it was old time remedies and natural things, and it was more concern, more compassion, more time that we would take. It's more high touch than high tech. Okay. So over the next few weeks, it's this week, and then I'm doing at least two more sessions on these next couple of Saturdays on one, what's going on in the healthcare, in the natural health and wellness industry. What's going on there? Okay. Two, what's trending? Okay. What are the things that people are most desirous of? Where are there opportunities for businesses and growth as well? So I'm looking at, and I'll be addressing health and wealth. Why? They go hand in hand. And I know sometimes people don't want to talk about money and, we should just, we should just do it for the good of people. Well, I couldn't run a business just helping people without getting compensation. And then the other part of that is that when we go from a society and a community where people are using drugs and alcohol and tobacco and processed foods and these things, okay, the reason why these industries flourish is because they're profitable. If you want to stop address the drug problem, take the profit out of it. Make it, if you want people to stop eating as much meat or processed foods or something, make it so expensive that people look at it and say, I can't afford that, and they won't buy it. So if it's not affordable, accessible, or appealing, people aren't going to do it. So my contention is, and is the mission of the Holistic Training Institute, which is a state licensed proprietary school for naturopathy or this natural health studies, is that we have to get trained healers in every home, in every family, in every community, and show them how to generate businesses from that. Therefore, we go from dealers to healers, right? And reminds me of George Washington Carver. George Washington Carver was around at a time where cotton was king, and he had to speak to the farmers and uh, and tell them that growing cotton was destroying the land, and it is. It's a crop that you can grow, um, for a period of time, but it robs the soil of nutrients, and so he had to share with them that the theories of crop rotation, uh, allowing the land to rest, and planting soybean, sweet potatoes, and peanuts, which are soil rejuvenators. Okay. And so essentially, cotton was king. Cotton was the crack of the day. Cotton was the cocaine, heroin, whatever we want to call it, of the day. It made a lot of money. The farmers would say, that's our cash crop. You can't take that away from us. And so the reason why he came up with 300 different uses for the soybean, peanut, and sweet potato is because he had to make those cash crops. He had to make that a viable alternative. So he had to say, okay, well, I understand exactly what you're saying. You're making money from cotton. That's feeding your family. That's taking care of everything. People are getting rich from that at the time. Okay. So you got to have a suitable replacement. You have to have other replacements. And so those industries essentially were built and grew based on his agricultural practices and what he promoted. And so I'm saying the same thing exists today, is that you can't just say no, don't sell drugs. Why are these people selling drugs? Lock them up. You're not giving them an alternative. So I see the health and wellness industry as being that alternative. And I'll tell you why. Okay. So one, let me give you some numbers here. The health and wellness industry represents $276 billion in revenue. Okay. And that's a whole lot of money for those number folks or anybody look it up. That is a huge industry, and it's projected to go, the natural products industry is $276 billion. Health and wellness is even larger than that. That is all the things, and that constitutes all the things you see in the health food store, all vitamins, minerals, herbs, functional foods, the vegan foods, and pretty much all those things and more, and even some appliances and such, right? So when I was growing up, there was no Whole Foods. An average health food store, the few that existed, were about 1,000, 1,200 square feet. Okay. Now we got large stores for health foods. So the industry has grown, the interest has grown, baby boomers, young people have grown, the health foods, the fitness clubs, and a whole lot of other things directed to people preventing illness, losing weight, feeling better, this whole area. So, and $276 billion. When I went to Expo West in California, I was there to go to a conference that was industry specific. Lectures, the new breakthroughs and everything that's going on with the natural products industry. Because they see this occurs twice a year. And this particular one, there was probably 70 plus thousand people or so there, about somewhere probably 3,500, 4,000 vendors or so. The largest has been 86,000 people. And these are people who work in the industry and not the general public. So the industry has grown exponentially and is projected to grow to 300 billion by 2024, which is not that far away, and 400 billion by 2030. Okay, so it's indicating that the interest and the trajectory for people utilizing natural products and looking for natural remedies is going to continue to grow and it is a mega trend, would be considered a mega trend. Okay, it's not just trending, it's not a fad. Okay, it's not just a trend, it's mega trend. It's, we can't even see the end of this, and it impacts every aspect of our lives. It impacts our what we wear, what we have in our homes. I mean, just every aspect from skincare, every aspect of our lives is being impacted by natural products and the choice for a more natural lifestyle that solves problems for people in ways that are good for the planet, and that are principled, okay, moral and principled, that helps people, that's profitable and tends to be philanthropic as well. Okay, so there's an opportunity for people to do well by doing good. And so, in forming Detroit Holistic Center and in sharing products with people, and these and the products, the services, the methodologies, is an attempt to accomplish exactly those things. So for those people who that resonates with, that's that's that is the way that things are going and life is going, and it's a tremendous um, opportunity for us to do what George Washington Carver did with the farmers who were uh, growing cotton. Say, you can grow something, you can make money, you can feed your family, but you can also do it in a way that does not damage the environment. Okay, and it's not polluting the water, the air, the land, the water. It's not killing people. It's not it's not engaging in child labor, or or slavery, in practices that work against humanity and our greater good. Okay, so this is what I've been doing. So I've been going to this conference and been studying this area and been in this area for a long time. Again, not just because uh, I wanted to make a living, or I thought I was going to make a lot of money from it, but because I saw it as being something that it made sense. It resonated with me, and it's resonating with so many millions and tens of millions or hundreds of millions of people around the world. This is a movement, and this is something that resonates with people no matter where they are, whether they're on this continent or another. So again, so for the next 3 weeks, one, trends. So today I'm going to talk about trends. So here are the pretty much the categories that I'm going to share about, and one is the trends in the industry. And so some of the major trends, and not in no particular order, relate to um, uh, the one, the immune system, especially in light of COVID. There are, I'll say, the world is more aware of and more concerned about the health of the immune system. So, uh, uh, just by way of reference, the it one time in the industry, the products that relates to the immune system, the things, the echinaceas and the um, and the castor oil, or different products that and foods that benefited the immune system, typically sold in the cold and flu season, right? Or what we call the cold and flu season. That expanded to those products being sold all throughout the year. So people are more aware of and more desirous of products for the immune system. That's one. Two, the digestive system. You'll hear more about gut health, and you'll continue to hear more about that, because the digestive system and the immune system, one, work hand in hand. So, and if you're not breaking down and absorbing, you're not just what you eat, you're what you digest, what you absorb, what you assimilate, and what you do or do not eliminate. So gut health will continue to be a major concern. And some people told me I couldn't operate Detroit Holistic Center. The folks in Detroit were not going to come to us. People got colon hydrotherapy and probiotics and products for the digestive system, like 90 going west, over the years. There's been a growing interest in this, awareness and demand. So for those of you who want to know what to do for you and yours, and working with the immune system, working with the digestive system, are two key areas that are vitally important. We talk about cleansing or fasting or rebooting our systems or making changes. You can't do it, you're not going to be as effective. You don't address the immune system, the digestive system, do some type of cleansing, get the old stuff out and get the new things in. It really, all the gut also relates to, it relates to every system of the body, directly or indirectly. Okay, our brain health and our ability to manufacture certain hormones, okay, is reliant on our gut health. And probably the number one reason for a long time, the number one reason why people went to the doctor is because they had some problems with their gut, from constipation, chronic indigestion, any number of different things. And when you look at the products that are sold on the market, there's always something. They're always talking about something for the digestive system, and that's because of the way we eat and drugs and a number of different things. Okay. Now, the other areas are the central nervous system, things that relate to brain health, dementia, and Alzheimer's and such within elderly population, but also the ability to be more aware, more cognizant, learn faster, and be able to focus better. That's those things, and any disorders that people have. We're talking about mental disorders. That's an issue. They're saying, oh, okay, there's a lot of people who are undiagnosed. Well, that's a health problem. That's a kind of a mental health problem. That's a physical health problem as well. So products that help to support focus and function, both in young people, in people who are in our more productive years, as well as the aging population, brain health and their neurological functions and system is going to continue to be key. Now, then there's also the area, this area that, and I'm going to tie that right into the CBD and cannabis-based products and such as well. And what that is able to do as well. We have a system. So of the systems of the body, if you're familiar with the body system, and that's some of what I share in my class, in some of my courses here. There's a system that most people in the mental health, in the health arena, are not familiar with. If you go to nursing school, whether you want to be a CNA or LPN, RN, doctor, whatever, they do not teach health and nutrition. They do not teach prevention. They don't teach alternative treatments for the most part. And they do not teach about a vitally important system, which is called the endocannabinoid system. Okay. Yeah. Okay. Okay. What is that? Endo, ENDO, cannabinoid, CANNABINOID, the endocannabinoid system. That system is vital and integral in helping us to maintain balance. Okay? And so we're learning more and more about that, about this system, and about which foods and behaviors will build and sustain the endocannabinoid system. Many of the problems that we're having could be addressed and alleviated more effectively if we understood and helped the endocannabinoid system. Okay, and so when you see CBD products and those things, I'm not saying just smoke some cannabis. That's one delivery system for an essential herb, and I do consider that to be an essential, a helpful and a medicinal herb when applied and used properly. But that's something that's again trending. That's something that's vitally important. That's something that you'll be hearing more about as you go along. And then, of course, men and women's reproductive health. That's as we have boomers, an aging population, and uh, uh, that his influence so much of the industry, menopause, andropause, uh, these stages of life, people are going through hormonal changes and all types of things that's affecting their health, from their hair, the skin, the nails, how they feel, all types of things. So earlier in life or during the productive years, fertility issue, and fertility issues and concerns, people not being able to conceive or carry a child to term and those types of things. That's been increasing. Problems and challenges in that arena has been increasing. ED in men has been increasing, and our whole concerns about our reproductive system, reproductive health, and and cancers related to the reproductive system, prostate cancer in men, and uterine and cervical cancer and such in women, is and will continue to be a major issue. So those are some of the areas where there's great concern, where people are looking for answers, and they're looking for natural answers. Okay. Then there's a whole area. Again, I'm going to go back to the immune system, and I'm going to talk about a specific aspect of it, not just colds and COVID, but cancer. What are we doing? The rates of cancer uh, are are getting close to the rates and incidences of people dying from heart disease. Heart disease continues to be number one killer of Americans, particularly adult Americans, and cancer is number two. But cancer is increasing as well. Probably everybody on this call and everybody who will hear this knows someone who uh, has or had or passed away from cancer. That'll continue to be a problem because of the way because of our environment, we live and what's going on. So people continue to look for answers to prevention, and not just say we need more chemotherapy, we need more drugs and things of that sort. Okay, so those are some of the key areas. I brought back products that from some of the companies in the industry, and as they share it at the trade show, and I get, my objective is to get the cutting edge information, the best information that I can share with my students, with my community, so that you are armed, so that it's not a 10-year gap in between the time that something is discovered and something becomes available, and there's something you can do in the time that you get it. There are very few people of color who are there. I go as press because I write for a magazine, I do a newsletter, and I'm doing the social media, and the radio, and I'll continue to do more radio and media types of things, because we got to get the information. People need information, but just as importantly, we need application. Okay, so faith without works is dead. It's nothing. We need faith, we need the information, and we need the application. We know that tobacco use is not beneficial. It's not good for you. Will undermine your health and cause a number of problems. But where's the application? People stopping. People just get the information and say, "Okay, I'm gonna stop." Okay. People are still using crack and in drugs, whether prescribed or not, and doing all kinds of things, even though they know it's not good. But what we need is the application. So training a healer in every home, training a healer in families and communities, and in designing or building a community and a culture of health and wellness is the direction that we need to be going in it as a community. Because if you know about health disparities, the difference in the health amongst African Americans, other people of color, in particular, what they may call BIPOC, Black, Indigenous, and people of color, the health disparities are vast. The health disparities are costing us at least 170 billion, costing the U.S. at least 170 billion dollars, just because the health disparities exist. Which means that if African American health was the same as the health of other people, white, non-Hispanic people, Asians and such in the US would save billions of dollars. Okay. So it's costing us as a country, it's impacting our economy, it's impacting us with the pain, the suffering, and all those things that go along with it. People are getting sicker. We're getting sicker sooner and we're dying faster. So when I go and when I've been going over nearly 2 decades, it's been because I know that we don't have, we're not exposed to this. We don't know about the products. We don't know about the methodologies for the most part, and we need that. It's similar to what was happening with the HBCUs. I had historically Black colleges and universities saw, oh, there's a gap in the education. We're not getting it. We're not getting access to the education. We're not getting the same education. We're not getting supported with this. Well, we need to get supported in terms of our health and wellness so we can close the health gap and we can close the wealth gap as well, because they go hand in hand. So there's an opportunity for people to go from dealers to healers, for our culture to go from drugs and alcohol and those types of things, saying those are fun behaviors, to something else where we're investing in our health and we know that we're spending less on things that really don't matter, cars, clothes, and all kinds of stuff. Okay, we're getting close to the top of the hour. I want to give you a preview, kind of a background overview of some things I'll be addressing. I'll also be addressing AI, what's called AI or artificial intelligence. You may have heard about Chat GPT and a lot of these artificial intelligence, I'll say, methods or applications that help us to do more with what we have, help us to create and be more creative and innovative. I see it as a positive thing. There are people who may take another viewpoint or be concerned about, is it going to take over? Utilized properly, it's like, is the internet good or bad? Well, guess what? You got the best and you got the worst. You got all kinds of stuff out there that's not good. And you have some things out here that are very positive that we can utilize as tools. It depends on our application and what we do and our intention and what goes behind it as well. So I'll be addressing within the next couple of weeks or so, I'll be addressing artificial intelligence and how that can help the average person to leverage technology to be healthier, wealthier, wiser. How we can use this to get, and how I will be using it to do books and writing and produce content for my courses and such, and do it like I have an assistant or more assistants. And by the way, I do need more assistants. I do need more people who are going to work with me to help to effectuate this and help to grow and move the Holistic Training Institute along, so we can take advantage of this 276 going to 300, going to $400 billion industry, because we have to, it's our awareness about it, it's having the context, it's forming community, and it's seeing the opportunity. So we're not just consumers, we're manufacturers and we're purveyors in this industry that is going to help to heal us, as well as for many people make 5, 6, 7 figures or so in doing so. I've been seeing it over the years, and the people are no smarter than you, they're no better than you, they're no more interesting, educated, or motivated as you are. I can tell you that. I've met many of them. I've met many CEOs and people in the field, and I know that if if you or you know someone who wants to do this, they can do it as well. It's not a problem. It's a formula. Okay, and success is not a problem. It's a formula. So if you know the formula, you know what to do. Okay, and so I believe that I've learned uh, more than enough over these years, and they have resources for those things that I don't know. Yeah, I don't know everything. I don't have the answer to everything. I don't know anybody who does. But to be able to tap into the resources and know where to get the answers is vital and key. I'm going to take a few questions. For those people who are in the room, I'd like for you to um, send, by way of chat, if you can do this, questions you have. Um, I may ask you to unmute, but I'm going to ask you to uh, ask you questions at this time. What questions do you have about the natural products industry and where it's going, or the business of it, etc.? Excuse me, I'm gonna take down my picture for this second. Okay. Any questions out there? Do I need to allow somebody to unmute? Who do we have? Do I need to call on folks? Okay. Okay, VJ. Okay. What can you do? Okay. I do have a question here that's in the chat. What can I do to be a part of this program? Well, here's something. Very good question. Thanks, Vincent. Here's something I want everybody to do. If you have not gone to holistictraininginstitute.teachable.com, and I say that kind of fast, so I'm going to ask Resourceful Risa to put that in the notes. Holistic Training Institute, that's holistic spelled with a W, holistictraininginstitute.teachable.com, and take a free course, it's a mini course on the top 10 herbs every home needs. Plug right in there. Take that. That's on me. Okay. There are other courses that are paid courses, of course, because we wouldn't be a school without paid courses. But that's a good start for everybody. And that's how one way we can get started. The other way is to contact and be in contact with me. My email address is holisticguru@gmail.com. That's WHOLISTIC guru GURU@gmail.com. I know it's a non-standard spelling on holistic, but it's been around for a long time. And it comes from the root word whole. That's another story. But do that. And I'm looking for people who are going to carry this legacy on. Okay. Those of us who may not be happy with what we're doing, want to leave our mark on the world, and want to leave the world in a better place. Now that's where this is going as well. That's part of the precepts behind this industry as well. And I'll be talking about that in subsequent weeks. Two, I want you to be on the calls, participate. So if I had 5 core people who are working with me regularly, then cool. If I had 5 core people who were working with me regularly, it's amazing things that we can do leveraging technology, because we can literally get this to millions of people. Okay, somebody was about to chime in. If you can if you can do me a favor and put it in chat, if you got a question. If it's a little long, then ask me if you need to be unmuted. Who was about to chime in? Okay. I know I had a couple of things in my notes here. So the Holistic Training Institute is doing classes online exclusively. Some of our classes will be live. In fact, I've got classes that will be starting in April. In fact, let me do this. I'm going to pause the recording right now. What there will be classes in April. I just don't want this information to be dated, but contact me, the holistic guru at gmail.com and holistic training institute.teachable.com. All right. All right. So, and if you like this video, it should be on Facebook and YouTube and some other sources as well. I want people to be able to get this, know who I am, what I've been doing, and what my mission and purpose is, and how vitally important this is to healing our community. The power is in our hands and in our ability. Training healers in every home, every family, and every community means we no longer give our power away to a medical system. People that don't know us, are not going to take the time, or don't have the commitment to us, don't love us like our family does, like people that we know that. When we take our health back, we take our wealth back, we stop the pain and suffering. We'll change this. I know we will. All right.